morning. I'm Dr. Rasta Esther. Now I'm going to present about the coagulants. Actually, what are the coagulants? These are the substances which promote coagulation and are indicated in hemorrhagic states. So, what are the hemorrhagic states? Means wherever there is a bleeding or whenever there is a wound or something injury to the endothelial cells of the vessels and the outer external injuries, so there will be bleeding, so that is called the hemorrhage. There what they are doing, they are in that particular states like hemorrhagic states, we need to promote the coagulations to stop the bleeding. So, fresh whole blood or plasma provide all the factors needed for the coagulation, which are best therapy for the deficiency of any clotting factors. Actually, there are different kinds of the clotting factors which are all present in the plasma or the blood in the human being. So, if the somebody have any kind of the deficiency of that those particular coagulants, they can be supplemented by transfusing the plasma or the blood. So let's come to the discuss about the coagulation cascade. Actually, how this particular coagulation is taking place whenever there is an internal or external injury of our body. Means whenever there is any wound or due to any kind of the pressure due to the hypertension or diabetes, because of that flow or atherosclerosis, because of the flow of the blood, there will be an internal injury, or maybe due to the some kind of the deficiencies of the factors which is also causes the internal injury. Actually, how this particular coagulation is taking place? Actually, I have told you there are many kind of the coagulation factors. Almost 13 coagulation factors are there. In it, actually, there are two types of the systems where there is a coagulation cascade are involved. One is the intrinsic system and the extrinsic system. Extrinsic system is nothing but whenever there is it's because of the bleeding due to the external injury, that is tissue damage leads to the bleeding. So to stop that bleeding, there will be activation of the coagulation, so that clot is blocking the further bleeding from that side. Intrinsic system is, it's due to the epithelial endothelial injury in the blood vessels. So whenever there is an intrinsic system, when there will be activation is when there is endothelial injury, there will be activation of the intrinsic system. There are so many from actually here through the intrinsic system. First coagulation factor can be activated is factor 12, activated by the contact. So when this factor 12 activated, this factor 12 is further activating the factor 11 to an activated form. From the factor 11, there is using the calcium ion. This particular factor 11 is activating the factor 9 to factor. Okay, here factor 9. This factor 9 is activating the to be activated by the factor 11. Actually, when the contact this particular factor is activated, So these particular, so what we are doing this here in this particular, this is activating. So here with this, it is with the 9 it is activating the, again 9 is activated. Here what is we are using,